You have joined another installment of ENVR 575 Applied Environmental Health. Today, we're going to talk about indoor air quality, designated sometimes as IAQ. So we'll talk, of course, about why we care about indoor air quality. We'll look at some standards or lack thereof. We'll look at some sources of indoor air pollution, something called SBS, Sick Building Syndrome. We'll look at some controls, some different resources that are available to you, and other. I'm not sure there is another, but we'll see. Why do we care? I'll try again to make this context, to take in this indoor air quality lesson in the context of the source mediation receptor diagram and see that there are sources of pollutants in an indoor environment that we are being exposed to most likely through the air in indoor air quality. And they are making their way to us, the final receptor. And we've got our diagram of our respiratory system, and that is the most likely means inhalation that we're going to take in these contaminants. Now here's the thing here. 87 to 90% of time is spent indoors. That seems like an awful lot. So that's 21.6 hours of your 24 is spent indoors. Which, yeah. And I guess when I stop to think about it, I'm not necessarily outside for 4 hours a day. That's kind of that's an accurate number for me. And I think I'm an individual that's more active, and so now I've been driving to work with the windows down to kind of increase I count that drive, and I'll take a longer route, so it's an extra 6 minutes. So over the course of the year, that's really going to bring that number down. No, not really. But so the point being 20 hours a day, and that number is probably higher for those that are elderly or those that are really young and spending more time indoors. And also to note, your exposures are 2 to 5 times higher indoors than outdoors. 30% of all commercial buildings have significant indoor air quality problems, as cited by who? That's right, the World Health Organization. There is something called SBS, or Sick Building Syndrome, kind of an antiquated term, but look at the numbers that are associated with it. $1 billion per year in direct medical costs associated with indoor air quality concerns, be them perceived or real, and $4.7 billion per year in lost wages and reduced productivity. That's not including work efficiency. So if you're at work and you have a headache all day, every day, or you don't feel good about the temperature of your working environment, you're not going to be as productive, and there will be some losses which are not captured in $4.7 billion per year. And then there's this final bullet that says comparative risk studies by the Environmental Protection Agency and the Scientific Advisory Board consistently rank indoor air indoor air, working air, indoor air quality in the top 5 environmental risks. So there can be a variety of these sources and pollutant sources, and some of them can be listed here, and you can think through them. But let's see if we can get this to work. We would go. You can have outdoor sources, which would be pesticides or automotive emissions that are being introduced into the house through HVAC systems or the air intake area for the house. You can have pharmaceuticals and personal care products, volatile organic compounds being contributed there or being contributed from paints. You can have incomplete combustion and particulate matter being introduced from combustion reactions or heating systems in your house. You can have this guy here who is contributing pet dander and maybe some odors that are less than pleasant. You can have this guy who's enjoying a fine tobacco product after a long, hard day at work. You can have Books, we don't need books. We should burn all books. That's obvious. We have radon down here that can be in the subsurface. No, wait a second. Books are okay. Books are good. We shouldn't burn books. But pressed wood is oftentimes in the pressing of woods in synthetic wood is introduced formaldehyde and other chemicals that then can off-gas and contribute to indoor air pollution. And that can be the same for carpets and stain resistant properties on this guy's settee, or is it a sofa, or is it a couch? This is probably a hideaway. And so there's a variety of these sources in the house. And then this last one down here again was radon migrating into the house from the subsurface. So some other, continuing our discussion about the radon, second leading cause of lung cancer, cited by the American Lung Association. There can be problems with HVAC systems. Legionnaire's disease hospitalizes 8,000 to 18,000 people annually in this country. The name came from the American Legion Convention in Philadelphia in 1976 when out of the 2,000 people that were there, 10% of them came down afterwards with some strange form of unknown etiology, this disease that the unknown cause, and found later to have pneumonia, progressed in pneumonia, and resulted in 30 or 60 deaths, I think 30, and hence the name Legionella. But it's a common cause if you don't maintain your HVAC systems properly and you introduce a moist environment, a dark environment, a warm environment. So it's a perfect breeding ground for microbial activity that then can cause some problems for us. And then, yes, so you've got the decay products of uranium that go to radium, which then go to radon. Radon is a gas, will find its way through the subsurface to areas of low pressure, perhaps a basement, because houses are generally kept at negative pressure. So the radon will migrate into the into your living space, and then as another source of contaminant. Continuing the radon discussion, here we go, with regards to Ohio and some of the levels of concern. And you see that in the subsurface, in the geology of Ohio, generally there's a lot of granite or uranium or radon being produced or decaying, making this an issue pertinent or relevant to those of us living in Ohio. 4 picocuries per liter is generally the threshold that if you have numbers greater than that, you might want to consider some mitigation means. If you're going to sell or purchase property and you get a radon test prior to that, which is part of the real estate transaction, if it's greater than 4, then you have to implement mitigation processes, or just evacuating and putting a ventilation system from the basement, and you're creating a low pressure center and evacuating that air and that radon gas out of your facility. So there's these tests that can be done, which are supposedly denoted down here, and those tests are relatively easy to conduct. You can conduct them if you're unsure or curious, and you can get them through the State Department, not the State Department, the Ohio the Ohio State Health Commission, which if you do a search on the internet, you can see where the state can provide you these and can ship them to you for about $20 per test, and you can run them for, I think it's 7 days, and that you can run some for a 90-day test, and the 90-day tests are more accurate to get an idea of the radon levels in your house. We know that smoking's bad for you. We know that smoking causes large amounts of excess cancers, and we know that increased respiratory illness goes up with smoking. And then with regards to secondhand tobacco smoke in children, science shows a wide range of adverse health effects that occur because of the secondhand smoke. and then this kind of the references are cut off here, but just I did that on purpose to communicate that these are all cited peer-reviewed literature studies looking at the adverse health effects associated with secondhand smoke in children, and statistically valid results, and reputable publications. Thorax is a reputable publication, so it's known that there are some negative consequences associated with this. Yet we still voluntarily undertake this activity. Yet there are no enforceable standards for indoor air quality. We're inside 22 hours a day. Yet the indoor air quality standards don't exist. And why is that? It's for a variety of reasons, but it's hard to regulate what you have in your house, and that's kind of an infringement upon your personal space, and a man's house is his kingdom. And who are you to come into my house and tell me that I have too much secondhand smoke in my house and I'm required to get additional ventilation or pollution source removal technologies? That would be hard to regulate. There are also consensus standards that are available. They do sometimes and oftentimes ignore combined effects, but there are standards that are published that you can look at and try to target. Specifically, I'm talking more to the work environment. And there's some guidance provided by OSHA and particular state programs, but generally it comes down to ANSI ASHRAE standards, American Society of Heating, Refrigeration, and Air Conditioning, ASHRAE. And those standards can provide some guidance as to numbers that you're trying to obtain if you're trying to diagnose indoor air quality issues. Are they real or perceived, and how can you, what factor should you focus on to alleviate these issues? There's also this CIAQ, this Committee on Indoor Air Quality, which involves 20 different federal agencies, and the co-chairs are listed on this slide. And they come together with their mission statement being to coordinate and share the exchange of information among different federal agencies, state governments, local governments, and the items, the communities listed on the slide here. It's sub-bulletized. I went on their website, and they have an index of their presentations that they've presented, and it looks like they provide 2 or 3 per year. It doesn't look like they provided any in 2015. Their next meeting is in February of 2016. But there's a variety of talks that are provided, and they have all the slides and the information and for this information sharing type initiative for this committee, with a website at the bottom of the slide for you to take a look at if you want to, or if you have one of these particular issues. So sick building syndrome, we kind of mentioned this earlier, somewhat of an antiquated term, but you do have issues of this, and people oftentimes call and complain and would like some action taken, and oftentimes, so the definition, sick building syndrome, is if greater than 20% of the building's occupants are complaining of issues due to the indoor air quality. You'll find some commonality in the symptoms, and here is a list from NIOSH, from indoor air quality surveys, looking at the percent of respondents and generally the conditions or the symptoms that they experience with indoor air quality issues. On the right-hand side, eye irritation and dry throat, headache, and so forth. And then there's this temporal pattern associated with when you're in the building and when the symptoms tend to alleviate themselves when you're outside of the building or on the weekends or on vacation. But sometimes they can be psychosomatic, sometimes they can be created by suggestion because your other coworker or coworkers are complaining of this. Then you might develop a headache or my throat actually is a little bit itchy now. But even if it's psychosomatic, don't immediately dismiss this, because this positive mental attitude associated with your work environment directly affects productivity And so if these concerns can be alleviated to some extent, and perhaps the symptoms might be psychosomatic, but if the working situation was changed in such a way that you were to change the temperature just slightly, then perhaps these issues would resolve themselves and you would have greater worker productivity. But there can be some more serious diseases or ailments associated with indoor air quality as well, such as Pontiac fever and Legionnaire's disease and humidifier fever, which again is this essentially all pneumonia-like diseases, Legionnaire's being the most serious of the three, which develops into full-blown pneumonia, Pontiac fever, which gives you, and humidifier fever, which gives you very similar symptoms, but doesn't progress all the way to pneumonia. Pontiac fever, Legionnaire's disease, humidifier fever, not contagious person to person. Just another little sidebar comment there. The main cause of sick building syndrome is inadequate ventilation, poorly maintained, poorly operated HVAC systems. So you can see this NIOSH study of 1,500 indoor air quality episodes demonstrating just that. 53% of the causes were associated with inadequate ventilation. But HVAC is the number one concern. And so if you can optimize your HVAC system, but the problem is the HVAC systems weren't adequately designed for the current occupancy load that a lot of these buildings are seeing or are being used for. Or you convert an aircraft hangar into a working environment. Again, the HVAC system wasn't designed for housing X number of personnel. Or over time they're not maintained, or so there can be issues with a variety of things, but generally speaking it's HVAC. So you can control indoor air quality issues through one of three means: source control and remove the contaminant. That would be the most preferred. So if your HVAC intake happened to be in the parking garage of a building where car exhaust was gaining entrance into the HVAC system, you could change that ductwork so that's not the intake area there. Or if it's outside right next to the smoking area, then you might want to move the smoking area. Try to control the source of the contaminant. You can provide additional ventilation, so that's dilution ventilation, and that's again reducing the amount of pollutant. Or you can try to introduce air cleaners, with a couple of caveats about the air cleaners. And it's difficult for gaseous sources, and plants can and do clean the air, but they might provide additional allergens, pollen, or mold that might cause other problems. So by and large, it's your HVAC issues, and it's these factors: relative humidity and odors and thermal comfort, with thermal comfort being the greatest source of disfaction. So some of these are subjective, but small changes can affect the belief that the quality of air is better, is acceptable. And so there are some different guidelines that have been presented, again, from ASHRAE, generally speaking, and relative humidity numbers less than 60% in the summer, but greater than 30 in the winter. You don't want it too dry. You'd rather not have any unexpected odors or cooking odors, or because those result in negative responses. And you can try to have workers have control of the temperature in their work center, and it improves tolerance, studies have shown, and there's some ranges that are associated on here for summertime versus wintertime. Those are first world problems, and we're worried about your temperature being 2 degrees too hot or 2 degrees too cold. From developing communities and developing countries, is a much larger fact or issue, and some of the numbers here are rather startling. But 4 times 10 to the 6th, 4 million premature deaths per year is the fourth worst health risk in the world, as cited by the US EPA. And it's due to indoor air quality issues and cook stove smoke and particulate matter because they're not optimized and have adequate ventilation or the right fuel to air ratio. And they're burning not just with cook stoves, but they're just burning with open flames. How many are burning with open flames? 3 times 10 to the ninth. 3 billion people. 3/7 of the world's population are burning solid fuels for cooking and heating. And that's indoors. And it's not just charcoal and hardwood, but they're burning anything they can get their hands on. So the second word there is dung, less than optimal to burn. And these contribute indoor air pollutants, and you have a greater number of respiratory illness associated with or due to this. And it's a cascading effect. You have an unhealthy population that is less productive, less likely to get educated. And so this kind of the pictures here are this charcoal project, which is started by MIT and some other organizations, but they're looking at this sustainable, community-led total initiative where they introduce this whole sustainable construct into, instead of chopping down all your trees, Easter Island, don't do that. Use maybe some of your waste streams from crop residue, corn husks, and convert that into burning materials, charcoal, to improve livelihoods, and then sell that to make a market economy so that you get this buy-in from the bottom up as opposed to just providing new cook stoves to one community every year in hopes that they'll start using them and they'll understand the process. But this community-led initiative ties in education and ties in economics and ties in a business model and ties in using materials they already have, natural materials. So certainly a larger role indoor air quality affecting the world and affecting developing countries more so than some of the complaints and the first world issues that we tend to focus on here sometimes. So it's just a matter of perspective and keeping things there. There are no standards, so we can't do anything. Well, that's not entirely true. There are some guidelines, and one of which is, this one's developed by ASHRAE, and it's like a 700-page document, so it's a biggie. But know that there is guidance that's out there and that's available. And so this is a pretty good one, and it breaks things down into 8 different objectives, looking at different indoor air quality issues and how to improve indoor air quality. And then you can take a look at limiting entry, controlling moisture in building assemblies, objective 2, and then those objectives are broken down into subtasks. And you can find your issue or look for identification of your issue and try to solve that to improve the air quality within your building. And so again, a pretty thorough document. And if the 700 pages isn't enough for you, each strategy or each subtopic then is broken down and has all the references. And so a pretty decent, solid reference for turning to dealing with indoor air quality issues. So why do we care? Standards, sources. I guess we're inside a great proportion of time. There aren't a whole bunch of standards that are associated, hard and fast standards associated with indoor air quality, but it can affect worker productivity. The types of contaminants that we're talking about are chemical, from VOCs and personal pharmaceuticals, personal care products, and carbon monoxide and emissions from outside coming in. They can be biological, the pet dander example, and the bioaerosols, and they can be radiological in the fact that it's radon underneath the slab of the house or in coming into the basement. So those are some of the sources. We talked about sick building syndrome, ways to combat that, the importance thereof. We talked about different controls and resources that you can look at. And we also talked about kind of balancing this with the developing communities. I guess that was the other unfortunate topic that it falls under, when it's probably the most important of all of them. But the developing communities, and 3/7 of the world population is burning materials inside their house without adequate controls or adequate ventilation, and it's resulting in a lot of adverse health effects. So the importance of indoor air quality. Hope you appreciate it, and we'll talk to you next time. Thank you. And good night, America.